Mr. Secretary, real quick thing, I think we have a 6-degree of separation relationship. You clerked for Scalia. His aunt, who was very, very proud of him, was my both French and Spanish teacher. And he comes from Trenton. I want to ask you a couple of quick questions, and I have some questions regarding New Jersey specific. Number one is that you were quoted as saying we have a 30,000 stockpile of masks, and if there's a real pandemic, we need 300,000. And since we generally see products of that nature come out of China, where will we get ours and be prepared?
Well, thank you. And first, I'd like to actually clarify something that I said yesterday in the Senate Appropriations Committee. I had been informed of some information that's a bit different than what I had at the time. To clarify, first, we have more masks than the 30 million that I related yesterday. But we have a different mix of those masks than what we had been informed of. So we have 30 million surgical masks. Those would be the gauze, tie behind the ear type masks, meant to really protect people from the healthcare worker spreading. We have 12 million N95 NIOSH certified masks in the stockpile, and then we have about 5 million N95 masks that I believe may have expired. They're no longer NIOSH certified, so they wouldn't be.
So where do we get the rest?
And then we would need, and so what we've talked about is approximately 300 million additional N95 masks from the emergency supplemental. We've already, from the reprogramming.
But where will we get them?
Well, so from the reprogramming, we're going to initiate immediately procurements to do domestic manufacturing around N95 as quickly as we can scale it up. And then if we get the emergency supplemental money on the Strategic National Stockpile, that would add on to those contracts. It will be, I do want to caution, it will take time because China, as you rightly mentioned, China does control a lot of the raw materials as well as manufacturing capacity.
Thank you. I need to ask you some New Jersey-specific questions because New Jersey has been designated a funnel airport, which means that individuals who are contagious or could possibly be contagious could possibly be contained or quarantined in New Jersey. So I'm interested in sort of the costs associated with our responsibility to do that, and I know New Jersey's gearing up for that purpose. What do you think is an appropriate and fair model to reimburse the states for costs that might be incurred over incidences like that, including quarantine facilities, test kits, overtime, service, that kind of thing?
Yeah. So first, with regard to the emergency supplemental, that's exactly why we're asking for a large amount of money to help state and local governments with larger scale containment activities. With regard to the particular issue of Newark Airport as one of the funneling airports, that means individuals who've been in China within the previous 14 days would be directed by DHS into Newark and others. We've worked very collaboratively with New York, which if we have any cases that required actual quarantine, New York has taken those on out of the Newark Airport, New York. And then the others really shouldn't be an impact on New Jersey because at this point, because we're screening them with CDC and DHS people for health screening, and then the rest of the people are going on. We've screened, I believe, total about 46,000 travelers and have yielded only, I believe, 17 nationwide who've actually needed to go into quarantine because they were in Hubei province.
Okay, then let me clarify something from my own self. That they are being brought in and looked at in Newark. There's no provision or no discussion about those individuals who need quarantining being on like the joint McGuire Air Force Base, which is more southern New Jersey.
I don't believe so, but I'm happy. I certainly can be corrected on that, and we would get you updated information. My understanding was that what we worked out was that Newark would funnel, that any patients with Newark were going to New Jersey, but let me get you that because to New York. I'm sorry, because let me get. I want to make sure I'm right about.
Yeah, would you please? Because I understand that that's going to allowing that is going to expire on March the 5th. But if there's going to be this need, we need to know what the emergency response is going to be to do that.
Sure, I want to make sure I get you accurate information. If I could, we'll call your office after the hearing to get you.
I think that Ms. Frankel made a comment about sort of the organization of the administration's response to pandemic diseases and things of that nature. And I was wondering why we don't have a quote-unquote czar and why this administration is not organized in a way that there is a person at the top who represents sort of the policies and has some authority, because I know we had a pushback between the CDC and the State Department in terms of flying individuals who were contagious on the airline. So why don't we have that structure? What is the plan to have such a structure, and is there a plan to have such a czar?
So
Thank you, Madam Chair.
So under the national, if I might, under the National Response Plan, Emergency Support Function 8 for public health emergencies, I am the lead, mine is the lead agency. I actually helped build these plans decades ago for pandemic preparedness and after 9/11. So I serve as the lead on this while it's a public health emergency. I work on a daily basis with the Chief of Staff and the President, and so if there's any deconflicting of agencies needed, that can happen there. So we effectively get that same function, and it's just the long-standing doctrine that this should be led by HHS with a public health emergency. There's not actually a change. The oddity was actually what President Obama did with the Ebola response. I don't know why they felt things weren't working and needed to do that. This has been the smoothest interagency process I've experienced in my 20 years of dealing with public health emergencies.
Congressman Harris.
Thank you very much, and thank you, Mr. Secretary. And I have to tell you, after hearing your testimony, you know, the inference that no one in the administration knows about coronavirus is pretty stunning. Your knowledge is actually as up to date as you can get about it. I will tell you the other fake news is the budget is referred to as cuts to Medicare and Medicaid. And, you know, the first time I heard that, I went back and looked at that budget document. Medicare and Medicaid spending go up every single year in the president's budget, don't they? So only in Washington, that's a rhetorical question, I know the answer is. So only in Washington is an increase called a cut. I'm not sure I understand it, but we'll leave it at that. Let's talk about the emergency funds. You know, I haven't been aware of anything that could be done here in the United States that hasn't been done. Let me bring a couple of examples. For instance, we know that Moderna, I think just yesterday, shipped their novel vaccine 6 weeks after the idea of making a vaccine